Hello and welcome everyone. Thanks for joining us for today's webinar on demographics and COVID-19. My name is Zach Biggs and I'm the research coordinator for international policy and trade at the School of Public Policy at the University of Calgary. The School of Public Policy is Canada's leading policy school, known for our practical research and for bringing people together to discuss the important issues with experts, which is what we're here to do today. So today we're hosting another installment in our webinar series on the public policy implications of the COVID-19 pandemic. We will post a recording of this webinar on our website and our YouTube channel, where you'll also find all previous webinars in this series. As I said, the topic of today's webinar is demographics of the COVID virus. So I'll be acting as your moderator, and serving as the talent today is Dr. Kevin McQuillan. Kevin received his BA from the University of Toronto and his PhD from Princeton University. He joined the University of Calgary in 2007 and served as Dean of the Faculty of Arts and Deputy Provost. He's also the author of Culture, Religion, and Demographic Behavior, and his articles have appeared in leading journals. He's currently Academic Director at the School of Public Policy. So for our format today, Dr. McQuillan will take about 15 minutes to give a briefing on the issue, and then we'll have about 15 minutes of audience Q&A. So if you could please type your questions in the Q&A box below, and I'll pose as many as I can get to. So now I'd like to turn this presentation over to Dr. Kevin McQuillan. Take it away.
Thank you, Zach, and thank you to everybody for joining us today. Demographers always think there's an important demographic component to any big public policy issue, and certainly we believe that's the case with the coronavirus epidemic that we're all dealing with right now. I want to cover a few elements of that, and I will try to stay to our 15 minutes that we have set aside and cover what I think are some of the most significant elements of the situation we're dealing with. So first of all, from a demographic perspective, I think there are two things that we often ask ourselves. How does the structure of a population influence the impact of the virus in this case? And then secondly, how might the pandemic that we're experiencing shape our population going forward? So one of the first things that demographers always talk about is the impact of age structure. Most things that we're involved with in our life, whether it's when we get married or having children or buying a house, tend to be related to our age. And so when we look at different populations with different age structures, that will have an impact on how various forms of behavior are played out within a given society. So when we think about the situation that we're dealing with right now, what we are seeing is certainly that the pandemic, the virus seems to affect different parts of the population differently. That's not always the case, by the way, with respect to things like a virus. If we look back to Canada's last huge experience with something similar, the flu pandemic of 1918-19, what we found at that point is it was actually young people, young adults who were most struck by the virus and experienced the highest rates of death. With the coronavirus, it seems to be different. As far as we can tell from international experience, certainly the case in Canada as well, it seems to be the elderly that are most at risk of suffering and certainly of dying as a result of this. So let me just show you a few things about age structure to show you how different it can be in different societies. So here's an example looking at Kenya of a population that's very young. Only 3% of the population is over age 65. We have a huge number of children in that society. It's really only recently that we started to see a bit of a decline in fertility. So if we have something like the coronavirus striking there, just looking at the age structure effect, we would expect it to be more limited for the population than it would be in some other societies. Compare that to something like Asia or Italy, where we're looking at a very old population. Over 20%, 21.7% of the population is over age 65. Amazingly, if you look at the size of some of those bars, what we see is that There are almost as many women aged 80 to 84 in Italy as there are girls between the ages of 0 and 4. And that really has been a significant factor in the Italian experience. We know most of the deaths have been concentrated in the older ages, and they have many people in the older ages, and that certainly has influenced the impact. If we look at Canada, we're closer to Italy, but not quite at that stage yet. Canada right now has about 17.5% of our population over age 65. You can see that the youngest age groups in our population are smaller as a result of low birth rates we've had in Canada for quite some period of time. And so as we look at either the Canadian experience or different parts of the world, what we will find is that the age structure of the population will be one of the factors that contributes to how serious the impact of the epidemic is. Another thing that we look at often is the density of the population. Are people clustered together either on a community level or more on an individual household level? We have seen, though the evidence is still limited at this point, that the highest concentrations of death tend to be in larger urban areas. The outstanding example here, of course, is the situation in New York, which has been far and away the worst in the United States. Complicated, of course, by it being an international city with lots of travel, people returning from other parts of the world. But generally speaking, density increases the possibility for the spread of the virus. But it's also true at the household level. If we think of the situation in Italy, for example, many people argue that the tendency for Italian families to cluster fairly close together, grandparents often either live with their children and grandchildren or very close by. There's a lot of contact between them. That's another thing that may have an impact on the spread of the virus. And I'll come back to that point in just a minute. So if we look at the situation, one of the questions we ask ourselves, there's tremendous level of concern about the virus. It's had a huge impact on societies around the world. And we might ask ourselves, is it going to have a significant impact on the death rate in the population or on population growth? If we look at the situation today and compare it to our last experience in 1918-19, the impact so far seems far, far less. Canada experienced about 55,000 deaths as a result of the great epidemic of 1819. Canada only had about 8.5 million people at that point in time. So if we project what that would mean for Canada today with a population of 38 million, we'd be expecting something in the range of 240,000 deaths. In Canada so far, we've had about 2,000. In an average year, last year, for instance, in Canada, we had about 290,000 deaths from all causes. So in addition of several thousand, and of course that number will grow in the days ahead, but if it were 5 or even 10,000, it would have a marked effect, but not a really dramatic effect on the death rate or on Canada's population. In other cases, it's somewhat larger. We've seen about 25,000 deaths already in the case of Italy. That number will grow as well. They've been very concentrated in terms of region, and so the impact might be significant. When we look at the future, I would say the biggest thing we need to worry about is the spread of this virus in developing countries. Many of the big cities in Africa and in Asia, we have tremendous population density. And of course, we don't have the advanced medical care system that we have in a country like Canada or in Italy. And I think that's something we're really going to need to watch. The numbers we've seen so far in many developing countries have been relatively small, but there's a real question, I think, as to how many of the cases we're actually able to track. And I think we will probably not know for some period of time how much it's spreading in various parts of the world. The other side of it that I want to talk about is what might be the effects going forward of this pandemic on population in Canada and in other countries. Oddly, one of the questions I've had most often up until now is, will our current arrangements, our shelter-in-place approach, produce a baby boom? I think the sense is people spending a lot of time at home might lead to potentially births that might not necessarily have been planned. My sense is, in a country like Canada, in which overwhelmingly childbearing is now planned, where obviously contraception is widely available, as well as access to abortion, that's a very, very unlikely thing. The more likely thing we should think about is whether the economic recession that's tied to the pandemic will lead to lower fertility going forward. We've seen this in many other cases, maybe most recently in the United States after the 2008-9 recession that we saw. The fertility rate in the United States dipped and it has not recovered since then. And that's something that we should be thinking about as we go through our current experience. Will that effect be temporary or lasting? It's hard to say. For individuals who delay having a child, what we find is sometimes delay turns into the event never occurring. Circumstances change, people's plans change, and the child they had thought about having, they may not end up having in future. More on a global level, what we have tended to see all around the world is that once fertility falls, there's very little evidence of it coming back up. China is a wonderful example of that. When the one-child policy was first introduced in China, there was a sense that many people were not in favor of that, wanted to have more children. But recently, when the Chinese government relaxed the old one-child policy to make it easier for people to have at least two, we saw very, very little impact on the fertility rate. And so if we were to see a further decline in fertility in a country like Canada, where fertility is already low, the average woman has about 1.5 children, it could well be something that stays with us for a while into the future. The more significant thing, I think, though, for Canada as we look ahead is on immigration. Immigration is now far and away the leading source of population growth in Canada. Our plans recently have been to accept something in the range of 350,000 immigrants a year, and that's driving population growth, particularly in our major cities. What's going to happen in the year ahead, in the 2, 3, 4, maybe 5 years ahead, as we live in a time with reduced travel, with borders being closed around the world? There are two pathways that I think are important. One is maybe a rejection or at least a questioning of the notion of globalization that's been linked to more interaction across societies, greater movement of people around the world. We're starting to see elements of that already. We've seen the temporary closure of immigration in the United States that was announced just last week. Will that last for a long period of time? Hard to know. Even in Canada, the Premier of Quebec recently mentioned that with rising unemployment, particularly coming out of this pandemic, maybe it's a time to cut back on immigration. So I think we need to watch very carefully what people are thinking in terms of immigration, whether the strong support we've tended to see for it in Canada starts to weaken as a result of the changes that are occurring. And then finally, there's the more practical issue that many people are dealing with already. Moving from one country to another involves a lot of work. It means qualifying for immigration. It means submitting paperwork. Sometimes it involves taking language tests. And what we're finding is all of those things are more difficult for people now. So as a minimum, it's likely to lead to a reduction in immigration in the next year or two, just because of these practical difficulties. Bigger question, I think, is whether it will lead to a longer term decline in enthusiasm for accepting immigrants into Canada and other countries around the world. So let me stop there, and happy to answer any questions that, that people may have.
Great, thanks, Kevin. That was very informative. So yes, we're getting to the Q&A portion of the webinar. So I'll remind everyone to submit your questions down below by clicking on the Q&A button there. The first question we've got here is, why are different provinces and different regions being affected so unequally? I've heard that Quebec has over 1,000 deaths, while here in Alberta, we only have 66. Could you talk about why this inequality exists?
Yeah, it's a very interesting question, I think. There are a lot of things that people have pointed to in the Quebec situation. Some of them almost happenstance. The fact that in Quebec, the spring break week occurs earlier than it does in other parts of the country. A lot of people were traveling back either from the beaches of Florida, from places in Europe, may have imported that into particularly the city of Montreal. There's certainly some debate as to whether Quebec acted quickly enough to put in place some of the restraints that we're seeing on behavior now that might have slowed the impact of that. The other thing, of course, when we turn to the issue of deaths, is Quebec has a significantly older population than Alberta. And of course, as I mentioned, urban concentration is an important part of it as well. Montreal is a very large city. The density of population there, the use of things like public transit, probably some of the factors that have contributed to that. But certainly on the fatality side, it's quite amazing. Quebec is really less than 2 times the size of Alberta. And as you've pointed out, we've had over 1,000 deaths now in Quebec, and just 66, I think, is the current number for Alberta. So something certainly to watch as we move forward.
Okay, we've got a few questions here about the demographics of COVID-19 victims. I think we've all heard that it disproportionately affects the elderly. I wonder if you're able to kind of give us a ballpark estimate on what proportion of the victims are elderly, whether it's half or 3/4. And then another question here takes it a step further, asks specifically about whether in Sweden, which has taken a different approach, whether the demographics of the victims there are any different than the victims within, say, Canada.
Yeah, that's a very good question. The age one is a little bit more complicated than we might expect. I think one part of the question is, what's the probability of contracting the disease across different age groups? That, I don't think we have the data that we really need yet. We certainly know from a few places where we've seen more analysis done so far that it certainly strikes right across the age spectrum. And sometimes in the case of the elderly, it's perhaps not so much a function of their age, but rather their living circumstances. So again, if we look at the situation in Alberta, where many of the deaths have been concentrated in seniors' homes, that's true, of course, other places as well, especially in Quebec. It may not so much be that they're more likely to get the disease, but rather they're living in a concentrated environment where one person bringing that disease in can cause it to spread. The other case, so striking, of course, in Alberta has been the situation at the Cargill plant, where clearly the virus has spread very quickly, over 400 cases now, and very few of those people, of course, are elderly. So there's the issue of, can we all contract this disease? And the evidence would seem to be yes. The other part of it, of course, is, having contracted it, are we more likely to die? And there's no question that age seems to be very strongly related to the issue of the disease resulting in a fatality. Again, it's not purely an age effect. Of course, older people often are suffering other kinds of health issues as well. And that contributes to the likelihood that the disease may end in death. So age is a very important part of this, but I think it plays out in a number of different ways. The Swedish case, I think, is one we're going to have to look at more carefully. I think, as your questioner is alluding to, in Sweden, there was really a sense that we didn't need as stiff restrictions as we've seen in many other countries. It was more advising people on what to do rather than prohibiting them from doing certain things. The numbers have started to escalate in Sweden. I think when I checked this morning, there are now over 1,000 deaths in Sweden. So it's certainly had a significant impact. Longer term, I don't know what we will see. It may well be that other societies with more restrictive practices begin to catch up in terms of the proportionate number of deaths that they see. And if that's the case, then one might make the argument that so long as you're not overwhelming health facilities, having the deaths more concentrated in time might be somewhat beneficial. So I think the jury is still out on that. I think certainly most health professionals are strongly in favor of more restrictive rules about social interaction at this point. But I think it'll take a while before we get a good sense of what's happened in places like Sweden and what the wisdom was of taking that approach rather than the approach we've seen, say, in Canada.
Thanks, Kevin. We've got a good question here. It's asking about whether there's been any evidence in Canada whether the COVID-19 disease has disproportionately impacted certain ethnocultural or socioeconomic groups.
I have not seen much data on that. We do know that so far, at least, fortunately, there have not been many cases in Indigenous communities. And again, that may very well be related to the fact of where they are located at a distance from the larger cities that up until now have been a focal point for the spread of the disease. Certainly, some of the early impact of the disease, I suspect, was in the Asian communities. In Vancouver, very likely that was an element at the beginning because, of course, it was tied to travel from China where the virus had initially broken out. But I would be surprised if we saw very significant differences among ethnic groups across the country. What I think we will have to look at more carefully, of course, is the situation with respect to socioeconomic status. And some of what we've seen in New York so far, I think really reflects that. True, there's an ethnic element to it. We've seen higher death rates among African American and Hispanic populations, but I don't think that has anything to do with different biology, for instance, of various groups. It really has to do with their living conditions. Often lower income, often more people living together in a household, living in disadvantaged neighborhoods, more likely to be taking public transit, possibly more likely going out to work every day because of the nature of jobs that are held by people in those communities. So, I mean, my feeling is it really is more the socioeconomic side of things rather than questions of ethnicity or origin that are probably the most important ones.
Yeah, you mentioned that densification or the population density is a factor. From a policymaker's perspective, do you see potentially some role that they would play in encouraging lower density housing, lower density areas?
That's a very interesting question, and of course goes against what we have seen from most urban planning people in recent years, including, I think, here in Calgary, where there has been an emphasis on densification, on having more people live in the central city areas for both social and cultural and economic reasons. Also for the environmental side of things, that urban sprawl, lower densification, of course, is associated with greater fuel consumption and other environmental issues. So I think that'll be a very interesting one to watch as we come out of this pandemic period. There may be some people who say, well, I'm happy having my suburban household. I was glad I had, 3,000 square feet of space when we were all stuck at home for a month or 2 months or 3 months. And if that comes along again in the future, it'd be nice to have a big house out in the suburbs. I think there's some other pretty profound developments that are occurring that have led to densification in a lot of the major cities, certainly through North America and Europe. So I could be wrong, but I'd be surprised if we went down that pathway in the years ahead. I think factors other than the fear of a virus or a new virus coming along will probably drive the organization of cities and the choices people make about where they want to live more than would, as I say, the deciding that I'm going to live in the suburbs because I'm afraid there's another pandemic coming.
Okay, and do you think maybe policymakers should be thinking about a low birth rate coming out of this pandemic? And if so, maybe are there some policy levers that can be adjusted or pulled to address this potential low fertility rate?
I don't expect a dramatic impact. I do think that the very difficult economic times that many young people will experience over the next several years may lead some of them to certainly delay having a child, and in some cases maybe deciding to have one instead of two, or even none instead of one. I don't know that it'll be that dramatic. I think in terms of the policy side of it, this is an issue that demographers have debated for a long period of time. I think policy has often been successful in lowering birth rates. We've seen that throughout much of the developed world, certainly in Asia and in Latin America, where birth rates now are not that much different than they are in many developed countries. But I think we've had much less success, if we can use that term, in terms of increasing birth rates. A number of European countries have made significant efforts in this direction, making it easier for people, parents, but particularly women, to continue working after a child, subsidizing daycare, in some cases even direct transfers of money to families with young children. And so far, I think the consensus among demographers is the impact has been pretty slight. If we look at even some of the most generous countries in Scandinavia or in France, we see fertility rates that are pretty similar to what we see in North America, where we haven't seen such generous social benefits tied to having children. So there may be very good reasons for those policies beyond increasing the birth rate. There may be good reasons in terms of encouraging women to be in the labor force, allowing them to succeed in their careers, maybe good benefits for children as well, especially with high quality daycare available at reasonable cost for young children. But in terms of actually convincing people that they should have more children, there's relatively little influence, I think, that those sorts of government policies have much of an impact. Okay.
India's shutdown has been much publicized as it's, I think, the largest region to impose a shutdown. Do we have any clear numbers yet coming out of India and whether they're having success? Obviously, it's a high population density country. Do you have any insights on how they're faring?
Well, the numbers so far seem low. And there are two things, I think, contributing to that. One is the virus seems to have taken root later there than it did in many other countries, including in Europe. But the other factor, and the one that I think is of such great concern, is it's just so much harder to get accurate information on the numbers of cases in a country like India, with huge urban populations, without the kind of public health infrastructure that we have in a case like Canada. I'm suspicious of some of the numbers that we're seeing from various countries of the world, not because I think people are deliberately downplaying or underestimating the number of cases, just that it's so hard to be able to count those cases. There isn't the infrastructure for the kind of testing that would be necessary. People in many of those countries may be in a situation where they can't afford to seek out medical care if they're seriously ill. I think what we may end up seeing is that a couple of years from now, when we have more information on the number of deaths that have occurred, we will be able to tell by significant increases in the number of deaths, retrospectively, how much impact that the COVID virus had. It's an indirect way of doing things, obviously. It's not a direct count of cases or of being able to certify that a death is due to COVID. But I think when we see these kinds of blips associated with an event like this, after the fact, it lets us see that maybe things were more serious than we perceived initially. But there are a number of cases that I look at now. Egypt is one that strikes me. There have been a fair number of cases in Israel of much smaller society, obviously, in terms of population. The numbers from Egypt so far seem relatively low. You have a city like Cairo that has between 15 and 20 million people in it. If the virus takes root there, we could see large numbers of cases. But as I say, I think for a variety of reasons, the data we have available now doesn't allow us to estimate how widespread the virus is at this point.
Okay, thanks, Kevin. So I think we've got time for one last quick question, and it's a doozy. What is your opinion on herd immunity?
Well, that's a term that most of us, I don't think, had really heard about until 3 or 4 months ago. You know, with any kind of infectious disease, immunity growing in the population as a result of exposure is important. I'm old enough to have had both measles and chickenpox when I was a kid. And when my own children contracted chickenpox, I was very happy to be immune and not suffer any kind of relapse as a result of that. So there is an important element of that. I think the questions that we've really looked at here is, you know, how does that play out in a social context? If we just sort of let things go, so to speak, we would see huge numbers of cases spreading rapidly through societies. And to me, again, the Cargill experience we've had here in Alberta is such a striking example of that, that out of one workplace, we have had over 400 cases develop, and there'll probably be more very quickly because people have contracted it at work. Work conditions were probably a part of that. They brought it home, likely infected partners. Those partners might be going out to work and spreading it as well. So things can run out of control quite quickly. And this is a very serious disease from all we're able to tell up until this point. Even younger people are reporting that they've been very seriously ill. It's possible that the experience of the illness may be related to health problems that stay with those people in the future, make them susceptible to other kinds of health problems going forward. So I think the position that our authorities, the health authorities have taken, that we need to do what we can to slow the spread of the virus, to be sure that we don't overwhelm our health systems, has clearly been the wisest course to follow. That said, we're hearing a lot of discussion about subsequent waves of the virus in the months and years ahead. And a consequence of that, of course, will be to spread that through a larger share of our population. And hopefully those people will come out of it, if they do experience the disease, with a level of immunity. But I think the great risk, as I say, has been a situation in which, given what seems to be the ease of transition of this particular disease, that we do everything we can to limit the spread of it, recognizing that it's likely to be with us for some period of time.
Great. Okay, well, thank you, Dr. McQuillan, for providing your insight today. It's great to hear a demographer's take on COVID-19 and its public policy impacts. And thank you also to you, the audience, for joining us. The School of Public Policy will be hosting more webinars, so please keep an eye on our website to sign up for them as they get confirmed. Our next webinar is next Tuesday on April 28th at noon. The topic is municipal taxation during the COVID-19 pandemic. And the speaker is Dr. Almos Tassoni, an executive fellow at the School of Public Policy. So thanks again, everyone, and take care. Bye for now.
Thank you.